My name is Peter Edmondson, and I'm going to talk to you about the importance of good infusion of intramammary dry cow products. This is really important to minimize the risk of anything going wrong at dry off, and this can cause mastitis after calving or in early lactation. What we have to remember is that mastitis bacteria only enter through the end of the teat. So the importance of good preparation can't be overestimated. So we can do two things at dry off. The first is we can use antibiotic dry cow therapy, which will help to remove any bacteria that are present at the end of lactation. And these are mainly going to be staph and streps. So here we have Staph aureus and strep. So these will be killed by antibiotic dry cow therapy. We can also use an internal teat seal like Boviseal, and its function is to prevent new infections getting in the dry period, which will be from E. coli and the likes of strep uterus. So these products both have two totally different functions. So we dry cows off basically to allow the udder to regenerate and form new milk-producing cells in preparation of the next lactation. So what we need to do is we need to make sure that we prepare the cow properly for any dry cow process. And it really should be considered almost like a surgical procedure where we're going to use really scrupulous hygiene. With antibiotic dry cow therapy, what we do is we put in the intramammary preparation at dry off, and of course we stop milking the cow. So this allows high levels of antibiotic in the udder throughout the dry period, and it's not being milked out, and that is going to give us the best cure possible against staphs and streps. So dry cow therapy we should only be using in cows that have known intramammary infections. However, one of the problems we have is dry period infections. So when we come to dry cows off, we assume that teats seal completely after we dry the cow off. What we know is that approximately 50% of teats are open a week after dry off, and up to 25% are still open 6 or 8 weeks later. And the problem with that is that even though we've used an antibiotic dry cow therapy, we can still get infections entering the udder with E. coli and strep uterus. And what these will do is these will cause clinical mastitis in the following lactation. So the function of Boviseal is to create an artificial plug at the bottom of the teat to prevent new bacteria entering during the dry period. It's a very simple process. You create the plug, it helps to prevent the bacteria getting in, and this results in a 25 to 30% reduction in clinical mastitis in the following lactation. So every cow is at risk of having open teats, and so every cow is going to benefit from Boviseal. Antibiotic dry cow therapy should only be used in cows that we know have infection at the end of lactation, and your vet will be the best person to advise you on which cows should be treated with antibiotics. I think it's really useful to have a separate box for collecting sterile milk samples, carrying out CMT tests, or preparation for drying cows off. So this is a box with all the equipment I have. So what I have is I have my CMT paddle, I have my CMT reagent, I have my cotton wool swabs for cleaning teats, my surgical spirits in a squirty bottle, that's quite useful, pre-dip, and I like to use foam pre-dip because that works well. I have my sterile sample bottles, my marker pen, which is a permanent marker pen, and also gloves. And the last one is a pot for collecting cell count samples, and this is a non-sterile pot, and it often contains tablets, very different to a sterile pot, which you need for bacteriology. It's just a very useful way of storing everything at hand when you need it. So the importance of how we dry cows off is vital. We need meticulous hygiene. A farmer once said to me, this should be treated like a surgical operation. So what we do is the best time is immediately after milking, so we can do the job properly. We're not distracted by other things that are going on. We make sure that we put the correct intramammary tubes into the correct cows. So what we will do is we'll actually have a list of which cows will need just Boviseal and which cows will need Boviseal and antibiotic dry cow therapy. So the way that we do it is very simple. We assume, of course, that all cows have clean teats after milking. That's actually not the case. If we take a piece of cotton wool, and what we do is we put some alcohol on this and just wipe this cow which was milked very recently, and then we just wipe that teat, what you can see is there's actually some contamination remaining on that teat. So it's very important to ensure that we clean these teats and disinfect them properly before we put our tubes in. So the correct way to do this is what we're going to do, even though it's after milking, is we're going to pre-dip all 4 teats. We allow a contact time of about 15 to 20 seconds, and then what we do is we dry that pre-dip off with paper towel. So now what we have is we have clean, dry teats, and of course throughout this procedure we've got to wear clean gloves. And if the gloves get contaminated or dirty, then what you do is you remove them and replace them. The best way to do it is to treat each teat at a time. So what we used to do was we used to prepare all 4 teats and then infuse the intramammary tubes. We're better off and faster doing 1 teat at a time, starting with the teats that are furthest away from me, the front left, then the front right, then the back right, and then the back left. So that's the way that we would do it to ensure that we do the best job that is possible. So what we have is we have 4 clean teats. So now what we need to do is I'm just going to demonstrate this on the back left teat. I've taken my cotton wool soaked in surgical spirits and I'm now going to disinfect the teat end. So I'm going to wipe this carefully and I look at that and I see there's still some contamination. So what I have to do now is I have to wipe this again. So I'm going to use another one of these. You can use the wipes that come with the intramammary tubes, but I prefer cotton wool and surgical spirits. So now what we have is we have a clean, dry teat. What we're now going to do is we're going to take our antibiotic dry cow tube. There we go. And we're going to infuse that into the teat end. And then we're going to massage that up into the quarter. Now, if there's any doubt about how clean the end of that teat is, then what we will do is we will disinfect this teat again. And what we will do is we will apply that just to make double sure. You only do this if you think contamination occurred after you put in the antibiotic dry cow tube. Now what we do is we take the Boviseal, and what we're going to do is we need to make sure we pinch the top of the teat because we want the Boviseal to remain at the bottom. And by pinching the top of the teat, we now squirt in the Boviseal. I can feel the back pressure right there. And then what I do is take that out, let go, and what we have now is we have sealed the end of the teat. So we repeat that on all 4 teats, but always starting with the furthest teat first. And then when we finish, what we will do is we will apply post-milking teat disinfection like this. And that is the correct way to dry off cows. Takes a little bit of extra time, but it pays great dividends. If you make a mistake when you come to dry off your cows, then the risk, of course, is you're going to have mastitis around the time of calving. This could be a toxic mastitis, which could result in a very sick, or even worse, a very dead cow. So the very last thing we do is we identify all the cows that we've treated. So lots of farmers like to use tail tape. So we can put this on here. Really important to identify the cows that have been treated with dry cow therapy. Now that we've finished drying off our cows, we've just got two important things to do. The first is to record all these treatment in the medicine book. And the second thing is to make sure the cows remain standing for 30 minutes after dry off. And of course, the easiest way to do this is to offer them feed, because cows will naturally go out and feed 20-30 minutes. The teats will have completely sealed. It will allow everything to settle down, and a job well done. It's important to strip out cows after calving to remove all traces of Boviseal. You don't want Boviseal going into the milk. It will be picked up by milk filters, which of course should be changed every milking. But we need to also be able to differentiate Boviseal from clinical mastitis, which is actually very, very easy. And of course, Boviseal, not containing antibiotic, has no harm whatsoever to baby calves if it gets fed with colostrum. It's really important that anyone who's administering any intramammary treatments at dry off or during lactation knows exactly what they should be doing. All too often we just assume people know what is the right thing to do. But of course, over time, we can all develop bad habits. So training people in the correct way to administer intramammary preparations has to be worthwhile. In herds where there are multiple people who could be administering treatments, this becomes even more important, and actually having something like a written standard operating procedure is really useful, because then people can refer to this and make sure that they do exactly what is best for the dairy cow. Remember, if we don't have really good sterile intramammary infusion, then we can actually introduce an infection into the udder and cause mastitis. And that's the last thing anyone wants to have happened.